The Ohio Chamber of Commerce proudly brings you another episode of Down to Business, a podcast that elevates the voices of business, community, and thought leaders, aiming to empower you and your business. That's why we're here, to aggressively champion free enterprise, economic competitiveness, and growth for the benefit of all Ohioans. Now, without further ado, it's time to get down to business.
Welcome to Down to Business, the podcast where we dive deep into the heart of Ohio's business landscape. I'm Meredith, your guide through the stories, strategies, and successes that shape our state's vibrant economy. Whether you're an entrepreneur, business leader, or someone curious about the dynamic world of Ohio business, you're in the right place. Today, we're talking about the behavioral health crisis that is crippling our workforce and our state. I'm joined today by Luke Russell, Ohio Executive Director of the National Alliance on Mental Illness, and Molly Mottram, Associate Director for the Ohio Suicide Prevention Foundation. Both Luke and Molly are active chamber members who bring an important perspective to our Chamber Healthcare Committee, and I appreciate both of their willingness to be here today. So Luke, I'll kick it over to you. Why don't you briefly introduce yourself and the mission of NAMI Ohio?
Thank you very much, Meredith. My name is Luke Russell, and again, I'm Executive Director of NAMI Ohio, which stands for the National Alliance on Mental Illness. And we have 38 affiliates across the state, and we have a national NAMI. We're an alliance, and we are here to improve the quality of life, ensure dignity and respect for individuals with serious mental illness and their families. And really, we do that through education, support, and advocacy for families and their loved ones.
Thanks, Luke. Now I'll turn it over to Molly Mottram to introduce herself. And Molly, tell us a little bit about OSPF.
Thanks, Meredith. My name is Molly Mottram with the Ohio Suicide Prevention Foundation. I just first want to say thank you to the Chamber for taking up the issues of behavioral health in the workplace. It's critically important, and we're proud to be Chamber members. Here at OSPF, we're really focused on suicide prevention across the state. Suicide touches everybody on average. Ohio's losing 5 individuals a day to suicide. And so what we're trying to do is reach as far as we can into the community through resources, education, and awareness, just to try and help save one life. On average, a suicide loss impacts 135 individuals in a community. And so if our resources and education and trainings around understanding suicide prevention, warning signs, risks, and support for suicide loss survivors helps save one life, then that's our goal.
Yeah, and it's been great, like I said, to work with both of you. Both of your organizations are having a tremendous impact in our communities. And again, we look forward to continuing this partnership. But Molly, you started to talk a little bit about everything you all are doing. I know OSPF has spent a considerable amount of time working on an employer toolkit for Ohio businesses. Tell us a little bit more about this employer toolkit and how employers can access it.
Yeah, absolutely. So I'd like to paint the picture a little bit, though, to kind of give an understanding of why this issue should be important to employers across the state. In 2022, according to the Ohio Department of Health, like I mentioned earlier, on average, 5 Ohioans a day are dying by suicide. The population that's most impacted is Ohio's working ages. So in 2022, the highest rate of suicides were amongst those 35 to 45 in age range, both male and female, and 80% of our suicides here in Ohio are adult-aged men. And so what we realized was the best way to reach these individuals and these adults is through the workforce, through employers. And so we're trying to wrap our brain around how do we make our information, our resources more readily available to them. And we came up with this idea of let's meet employers where they're at by creating a resource guide around suicide prevention and crisis in the workplace. So we worked really closely just trying to analyze what information do employers need. We didn't want to create a guide that was 50 pages long. We understand employers have a lot on their plate, so we wanted to create a resource that was quick and to the point and gave enough information to implement policies and procedures and just have some general education around prevention and crisis in the workplace right at their fingertips. So we created our resource guide. We launched it in April of 2022. We've seen considerable success with it. We've reached over 500 businesses across Ohio with this resource. And in it is just some basic information on what is suicide prevention, what is depression and anxiety, what are some common myths, phrases, how to communicate with your employees about what suicide prevention is, or, if somebody comes to you in a crisis or saying they're struggling mentally, how to handle that conversation. There's also some resources in there. There's a checklist about for kind of like management, HR, leadership to evaluate what policies and procedures they have in place around addressing behavioral health in the workplace. How are they integrating behavioral health in the workplace through their benefits, EAP, information across the office. And then there's also information, something that's often overlooked is what to do following if there is a suicide in the workplace, whether that is a direct suicide from an employee, a family member of an employee, a contractor, somebody affiliated or employer adjacent. There's some right things and some wrong things. And so we created a guide, very short and to the point, of how to communicate to your employees and what resources you can make available to them. So we're excited about this guide, and we just wanted to put it in front of as many employers as we possibly can.
Yeah, and it's been something great for us as a chamber to push out to all of our members, also to the local chambers and, metro chambers throughout the state. And I guess, Luke, that's where I'll turn it over to you. Obviously, NAMI is unique. You have affiliate members all across the state. Just share a little bit about what you all are doing to try and reach, businesses and employers alike all across Ohio.
Yeah, thanks, Meredith. I would say if there's one good thing that came out of COVID is that no longer do people not talk about mental illness. And what's happened is we know that 1 in 5 Ohioans have been diagnosed with a mental illness. And because of that, we know the impact on communities, on schools, and on businesses have been dramatic. And what we're seeing is not only a higher demand for services, but also the acuity and the severity of some of these mental illnesses is just skyrocketed due to isolation, stress, financial, and all those things. And I love the guide that you guys were just discussing. And again, with NAMI, with our 38 affiliates, right now we cover, I think, 79 of the 88 counties. By the end of the year, we'll have 84 of the 88. So we're almost statewide. Every day in the state of Ohio, one of our affiliates is offering either an education group, a support group, or one of those activities I mentioned earlier around advocacy. But the 3 areas really, we educate, support, and advocate. And under education, that may mean, again, a brochure. It may mean someone going to our website, understanding what is bipolar, what is schizophrenia, what's the steps if I myself or a loved one has been diagnosed. We also do family-to-family education courses, which are 8-week long. They can be done online or in person. We also do another program called peer-to-peer if someone themselves have been diagnosed. Those are education. On the support side, we do family support group, which is, it's exactly like it sounds, families of those with a mental illness. And then we also do what we call NAMI Connection, where people with mental illness help one another out to really recover. Because in our field, we don't talk about that a lot, but I know of a lot of success stories, and a lot of that's because 80% of the caregiving is done by families. And if families know what to do, it circumvents, hopefully, an escalation of someone's mental illness or even the behaviors associated with that. And then on the advocacy side or even support side is we have a helpline. The phone's always answered. Some of our affiliates have helplines, and really that can take the form of referring someone to treatment, a treatment provider. We have a list of all the treatment providers, maybe the local county board if it's a client rights issue or some other issue. Or it could be sending the toolkit out to an employer. We get calls from teachers who said, I have students who are struggling with different types of mental illnesses. And our helpline coordinator, her name's Danielle, and she's an LISW. So she's a licensed independent social worker. She understands the clinical side of the nature, but she also understands where and when we are offering some of these courses I mentioned earlier. So again, every day in Ohio, these are being offered. And through our affiliates, we recruit volunteers to get involved in helping other people. So I think when we talk to businesses, if you have somebody who's open and honest with other folks about their mental illness, next thing you know, well, then it's not so bad for Joe to say, hey, I'm struggling with this, or I have a son or daughter who, they're not coming out of their bedroom, or this is going on. And someone knows, just that awareness to reach out to them and help them in their unfortunately, when someone's diagnosed, it's a different walk of life they're going to experience, especially if it's a serious mental illness like major depression, schizophrenia, or bipolar disorder. People really need to learn the effects of medicine, the treatment options, where to get help, how to not only find treatment help, but also support, housing, employment, other opportunities out there. I had a call, just real quick, an example from one of our board members who's a parent, and her son has struggled. He's been very stable. He suffers from bipolar disorder, and it's pretty severe. He's had multiple hospitalizations, but he's a good worker. But he struggles to keep a job. So he was not signed up with a local job employment group, which Ohioans with disabilities helps out. So once she knew that, she goes, oh, if he had somebody just to check on him once a week. And so we've set her up with someone who can do that. And by the way, the employer's thrilled because that means that person's going to be showing up every day to work. It just, if they have a little bit extra support and it doesn't cost the employer anything. So hopefully that helps. Yeah,
and to sort of segue into this, both of you talked a little bit about just the need for education for employers. And, you touched on it, Luke, briefly. As soon as a fellow colleague, another employee starts talking about the issues they're struggling with, it tends to allow others to open up. But there is no doubt that there is a stigma in the workplace. How do we overcome that? Molly, I'll just kind of turn it over to you. What are you all hearing from groups that are reaching out to you? What are you all working on to try and break down this stigma?
Yeah, I mean, I think, not to beat the drum, but obviously because we are far removed from COVID, but COVID did open up a lot of doors around actually having some of these tough conversations around mental health, particularly in the workplace. I think it's really important to be mindful that you don't leave your issues when you walk into the door at work. And a lot of times they're carried with you, whether it's your own personal struggles that you might be dealing with or your child or a loved one, if you're the primary caretaker. And so from a stigma perspective, and we always say that this is something that's really important because there's a lot of misconceptions around suicide and suicide prevention. Talking about the issue of suicide won't put the idea in somebody's head. And to your point, opening up about something you might be struggling with opens up the conversation, makes somebody a little bit more comfortable. So some of the things that we have done is just general awareness campaigns. We're constantly trying to put out crisis resources, like the Suicide and Crisis Lifeline 988, which launched 2 years ago. That is the 24-hour crisis line that you can call or text, making that readily available in the workplace, whether it's up in the lunchroom or posters are out throughout the hallway. You're including it in wellness Wednesday emails. Something we've encouraged employers to do are like lunch and learns, just to bring in. So there's tons of behavioral health experts, but on our team, we have Jason Hughes, who's a certified trainer in Vital Cog, which is our workplace kind of suicide prevention 101, mental health 101 in the workplace training, and bringing in that training, doing a lunch and learn about, what is anxiety, what is depression, making it an environment that you feel comfortable bringing it up, whether it's to your colleague or to your manager. A lot of that is just making information more readily available. And that's something that we try to do. We have tons of resources, RAT cards on almost every population. We have veteran RAT cards. We have information, resources in the Black community, youth, obviously workplace. And we are constantly getting requests to send a box out of resources. People want to put that information in the front office. They want to put it in the break room. We'll send that out. The more that we can make that information available and normalize having the conversations around it, I think you're going to continue to break down those barriers around stigma.
Yeah, and Luke, I know you touched on it briefly in your previous comments, but what is NAMI hearing about stigma? Obviously, since COVID, as you mentioned, folks are talking about it more, but what else can we be doing better?
Yeah, and I think, I heard that with the prevention piece, stigma reduction really starts with us doing more on the prevention side. And unfortunately, we all react to crisis. So it's like, the building's on fire, we call the fire department. Well, maybe we should have looked at the sprinkler system prior. Maybe we should have looked at what we have there. And I think more and more groups like Ohio Suicide Prevention Foundation and NAMI Ohio are looking at ways to get into the schools. So we're part of the school curriculum where they can call us up and we'll have somebody go out and speak to the students, not in the middle of a crisis, but just these are things you should be aware of and these are things you should watch for. I know Danielle, who's our client navigator, has gone and spoken to a couple of businesses, put together a little, what is mental illness? What is depression? What are signs? What are other things that we can do? Because what we know is if we focus on these things, we don't get to that crisis where the fire is going on. And Molly mentioned this 988, 988 is not just suicide prevention, it's also crisis. So, again, we get a call in our office if somebody is really in a mental health crisis, she can transfer them to someone. But what she loves is when she gets the call, hey, my daughter's at, X university. They called me, they said she's hearing voices. This is going on. Okay. You need to have her diagnosed. Well, she was diagnosed with schizophrenia. Okay, now let's go to our local NAMI and get her signed up for a class, but make sure she's still getting, our goal is to keep her in college. Our goal is to maintain quality of life like we all want. I mean, so really, I think it's looking more upstream. And we're starting to hear that more and more, even at the Department of Mental Health and Addiction Services. I think we're hearing it more from businesses. How do we tackle this issue up front so that it's not till it's a crisis and then Sally's going to have to miss work because her daughter's now in an inpatient unit somewhere, and really it's turned into that situation. And again, access, I think stigma reduction, the EAP program's great, and I know that a lot of those are employee assistance programs are great, and they're anonymous, and that's perfect. They can call NAMI Ohio. They can talk to our helpline, Client Navigator, and get help anonymously. But boy, if there's a way on stigma reduction, you can have somebody come in and talk to a group and talk about these are some of the things. And then every now and then there'll be somebody in the room who's a peer who speaks up and says, hey, my daughter's got bipolar disorder, or my uncle has schizophrenia, and I grew up in this life. And you know what? I think more and more, this is my gauge, and this is very not technical. When we quit whispering, well, I have, schizophrenia. It's like no one say, my uncle had schizophrenia, and guess what? Last 20 years of his life, he was a night watchman, and he did great, and he had a decent quality of life, and he had a family, and he wasn't hospitalized. That's success. And so I think just finding a way to really address it now, like we're doing here, just this podcast.
Yeah, no, and that's a great point. And just want to encourage, all of our members that are listening to this, or any other group and employer in the state, there are plenty of resources at your disposal to make sure you understand what you're offering to your employees and their health benefit package in terms of behavioral health and addiction treatment. So just want to encourage all of you, maybe refresh yourself if you're unsure of it, because if you're unsure of it, your employees are unlikely sure of it. And just make sure, they have access to that information. Make sure they understand if they have an employer assistant program, they know what that is, they know how to access it, what numbers to call if they need to find treatment. We're talking a little bit about the preventive measures. That's a big focus of the Ohio Chamber, is trying to make sure folks have early and often access to care. What happens though when we do reach that crisis situation? So if an employer receives a phone call, if they hear from their employee that someone in their family is in a crisis situation, or if, that employee themselves are in a crisis situation, what can employers do to help better prepare themselves?
Yeah, so I think one of the first things, talking from the prevention perspective, before we get to that point, I think something that would be really helpful that we always recommend for leadership, management, really anybody in the workplace should definitely take advantage of some trainings. Like I mentioned earlier, we have a Vital Cog training, which is mental health in the workplace. It really talks to you about how to talk to somebody when they're in a crisis, how to identify some of those red flags or verbal or indirect verbal cues. So doing some of those training and investing in some of that education. If somebody does experience a crisis in the workplace, there's several things. The best thing to do is obviously keep calm, don't overreact, don't leave that employee alone, but make sure that you have that information, the crisis information readily available to you. Obviously, we mentioned 988. We're gonna keep repeating that in the behavioral health space for as much as we possibly can, because it is a really vital and critical resource out there for that entry point to the crisis care system here in Ohio. So you can get them connected to 988. You can also connect them to the EAP if you have an EAP. And we understand not all employers have robust benefits for behavioral health services or an EAP. So that's why we talk about 988. But really just making sure, I would say 988 EAP. If this person is really indicating they are a threat to themselves, an immediate threat to themselves or others, 911 is something that you can also, is another option that you can take. But the best thing is to remain calm, have those resources readily available, and don't leave that person alone. But I think Luke probably might have some more to add to, if somebody's struggling with a severe mental illness.
Yeah, and I really like what Molly said about the investment of the management training, because a lot of us didn't go to school as mental health professionals, and some of us are even worse, that we're more analytical and we don't even notice people's behavior change. I think just the awareness and talking to people and showing empathy, I think our culture right now, not just politically, but also socially, there's a little bit of, we go to our homes, we shut our doors, and we don't engage with our neighbors. And I think that bleeds in the workplace about just being aware of what's going on around you. And I think beyond, again, I do not wait to use 988. I mean, if somebody's in a crisis, call 988. And I think Molly nailed it. If they're harming themselves If they're potentially harmful to themselves or someone else, clearly that's a 911. But even 988 for allowing somebody to use that. I think also, and I'm going to throw this out here, NAMI Ohio, our client navigator helpline, 800-686-2646. And again, 800-686-2646. Sometimes she just takes a call from someone and says, I don't know what to do. Like somebody told me to call NAMI. I was listening to a podcast and they said, call NAMI. And she goes, okay, tell me what the situation is. Sometimes that's just calling the provider, and she'll go the extra mile, linking them with a provider that will take clients for them just to go in and talk to somebody. Second, I think looking at and being, again, this goes with that empathy thing, being aware, and I think this goes to that training of managers. Usually there's other things that happen before it's a crisis. So their performance goes down. Like this is a high performer. All of a sudden it's like their performance down, or their attendance. They don't miss work for 2 years and all of a sudden they're in and out every other day. Something's going on. Or it could be even a behavior, like somebody who normally is pretty easygoing is real sharp, or the opposite, somebody who's normally very sharp, or they're extrovert, all of a sudden they're shutting their door at their office. They're not talking to their colleagues. Other people say, hey, is everything going right with so-and-so? Something doesn't seem right. Sometimes, as a manager, and I manage people, sometimes it's calling somebody and say, hey, is everything, this isn't about performance. This isn't about, you're a great employee. Is there something going on that we need to know? And a lot of times somebody will say, yeah, this is, I got this going on and I don't know what to do. And they kind of feel isolated. And that's the worst thing that can happen. So I think as we get into these kind of crisis situations, obviously 988, and we have even seen our client navigator numbers go down because more and more people are using 988, which is a good thing because that means people are engaging the system. So I think just that awareness and the warning signs and, just being a good fellow human being to one another every now and then and noticing things that are going on.
Yeah, and something I keep hearing from the both of you is just the emphasis of employers buying into training and making sure this is available to them and their employees. We all know there are many different industry types in the state. We have white-collar jobs, we have blue-collar jobs. Some of the excuses we may hear of why training isn't offered is they just don't have time. Their schedules are too busy. They can't make the time. They may be hourly, and so they're forced into a situation where they just can't step away from their work. What advice do you have for employers to kind of combat that excuse? And Molly, I'll start with you.
Yeah, absolutely. Well, so I think that, first of all, buy-in from leadership and management goes a very, very long way. When you have that from the top leadership investing in these kind of trainings and making them readily available, you'll see more employees buy into the interest of that. I think in the case of what we offer here at OSPF, I keep going back to Vital Cog. We also have QPR, which is question, persuade, refer, again, suicide prevention 101. We make it as easy as possible. It's free of charge, so we don't charge the employer if they're interested in offering this training. We can do it virtual and we can do it in person, and we'll do our best not to go over a 2-hour time frame of training. We will meet you where you are at. And I think that we have seen some employers make this mandatory for their employees. They do it quarterly. We've seen them make it part of their onboarding. And I think it's just kind of what works for your company and the schedule that you have. Like, for example, we on our team, I mentioned Jason, he's been out to several construction sites. So the construction industry just has higher rates of suicide and substance use. And what we're seeing on some construction sites is that they're actually taking time every morning to check in with each other. They have different names for it, but some of them are like mindful minutes, and they kind of talk about wellness tips, checking with yourself, how are you feeling? And Jason's gone out to some of these sites and has used some Vital Cog QPR training phrases, tips, and tricks to share with the construction workers. So meeting them where they're at and making it as easy as possible to buy into what you're offering is really helpful. So I would just say lean in on the resources in your community. There's tons of trainings out there that are available, and most of them are going to be free of charge. And I know that's a key thing for a lot of businesses across Ohio. It's like, we understand that it's expensive to have a business. And so if we can make it easy by saying, hey, we'll do this free of charge, virtual or in person, you just tell us the time and place, we'll meet you there and we'll make it happen. I think it starts at the top and, making it as accessible as possible.
Yeah, I would just add to that. I'm glad you said free. All of NAMI's programs and services are free to people. So we don't charge for education groups. We don't charge for the support groups. And even our client navigator, anything we do, it's kind of been our mantra for 35 or 40 years that we don't charge families, because a lot of times they're already stressed out about everything else, the last thing we want to do is put a charge on them. But I agree with Molly. I mean, keeping it simple. Sometimes we'll have somebody call in and we'll just refer them literally to our website. I mean, whether it's NAMIOhio.org or our national NAMI site, I can tell you right now, it is for laymen. So when you go on there and you look, it'll explain something that's going on. I use it sometimes when somebody calls and there's something going on. Well, what are the most common behaviors with this illness? What are some of the common drugs that are effective and not effective? And so I even do some of that because, again, time is usually the biggest issue we hear. It's not that people don't want to do it. It's not even sometimes the money. It's just, you know what, I've got to recruit more people. I've got productivity standards. I've got this going on. But what I tell people is if you dress this up front, again, it goes back to that upstream, you're going to save money in the long run because you're going to have less people missing work. You're going to have a better work environment, the culture of the work environment, and hopefully you'll see that increase in productivity because people are taking care of not just their regular health, but also their mental health. And one thing, I think if someone's diagnosed with diabetes, and if you don't treat that relatively quickly, it turns south. The average time between a diagnosis or symptoms and treatment in mental illness is 10 years. And by 10 years, it's a problem. So usually what you're dealing with is someone who probably either had a history or symptoms prior. So again, that idea of prevention and getting earlier and again, just training your managers to be aware. And again, there's some great programs out there. Again, you can call OSPF, you can call NAMI Ohio. We'll link you up. And like I said, and even work within the business's framework. What you said earlier, Molly, about going in the morning before they start. Or maybe it's once every quarter you do a picnic, or there's some activity that the company does for everybody. Having just somebody come in and tell them, you got 15 minutes. Tell us the X's and O's around mental health and mental wellness, and come in and just do that. So just little things like that, again, reduce stigma, increase access to care because people are willing to seek it out.
Yeah, and all of these efforts have to take place in order to prevent any of these situations from happening, prevent crisis in the workplace. But what can employers do after the fact? What postvention efforts can employers start to think about just that they continue to implement, they continue to reiterate to their employees? If something were to happen, what should they be doing as proper follow-up to ensure that that employee or their dependents have whatever they need to get through the situation they're in?
Yeah, so I think one thing that we talk about just in general is if somebody goes out on leave for a medical reason, typically there's conversations that are happening with management around when they leave, who's taking care of the work, et cetera, and then kind of bringing them back into the workplace and putting a plan in place of reintegrating them into the workplace after they've missed some time for work. We need to have that same type of, we would encourage people to have the same type of policies and procedures in place if somebody is out on extended leave for mental illness for some reason. So we encourage people to evaluate what do those policies look like. In the case of following particularly a suicide in the workplace, there's what we call it postvention, but in our resource guide, we actually kind of list out a step-by-step guide of what managers and leadership can do. And one of the things is, making sure that you're providing an immediate response. And it kind of goes in, and I don't want to spend too much time on that, but providing an immediate response, create a short-term follow-up recovery plan. And honestly, the most important thing is develop a long-term strategy for helping employees cope and manage. And I think the other thing is, the big thing is just reconsider and evaluate those policies that you have in place. What we often hear is that employers don't realize they need these resources or policies in place until something does happen. So proactively putting up, we have posters that you can put up around the workplace around what are signs of anxiety and what are signs of depression. We have rack cards that you can put that you could put in your onboarding paperwork that talks about here's all the crisis information, here's your EAP information, here's how to contact your insurance information. So I think one of the things is following a crisis, not only helping integrate people if they're coming back from a leave for a mental illness reason or following a suicide, is making information available, whether it's part of that onboarding just in the office, and being mindful of that and taking the extra step to pause, reflect, and putting together those really long-term strategies that we know will help, which we have more information in our resource guide. And anybody who does have questions about postvention, again, that's kind of an area where we want to raise a little bit more awareness on, always can reach out to us. We have some really amazing organizations that we work with, like Lost Community Services in Ohio, that provide support to families and individuals who've lost somebody by suicide. So always happy to help provide resources and guidance on that as well.
Yeah, and I would just say Molly and them do a great job in the suicide piece, and obviously that's very tangible in terms of it's here now. We have, what do we do? I think NAMI's perspective on the mental health side, and we talk about parity in insurance. We want parity in mental health, like the brain disorders, like physical. So, I appreciate people like, during COVID or after COVID, companies started instituting mental health days or this. Why can't somebody take a personal day because of their mental health or physical? Like, hey, I pulled a hamstring and I'm feeling good. Or the other option is, hey, I need a little bit of flex in my work schedule here. I've got this kid, they're struggling, they're home from school. Can they work from home? Can they flex their schedule? Can they engage? We do that for physical things. If I have an employee who has a father in the hospital and they're like, hey, I want to go in the mornings to relieve my mom and then come home, we ought to treat the same thing with mental health issues. And, if somebody's got to take a child to the doctor, whether they're a psychiatrist or a therapist or a regular general practitioner, it shouldn't matter. So we want to see like just that level of a parity within our own thinking about mental illness, because again, nobody dials up and says, I have schizophrenia. It's a brain disorder. There's chemicals and it can be treated, but we need to treat it like any other thing. And I think for employers, again, when somebody comes back, we don't need to treat it any different. A lot of times we always say mental illness isn't a casserole type of illness. When you say, oh, my son or daughter's in the psychiatric unit, people aren't coming to your house with casseroles. Why is that? Because it's still got that stigma. And the same thing happens at work. Joe's out because he had some mental health issues and everybody treats him a little bit like with kid gloves versus like go to their office. Hey, are you feeling better? Is everything going good? We're not there yet. We're getting there. But I think that's some of the posts after the fact. And again, I think as more people engage, I laugh because my youngest is a junior at Ohio State. Her and her friends will talk about mental illness like nothing. And then I know I have a family member who their best friend has mental illness, who I've known for years and didn't know it till one day the person whispered to me, hey, I love what you guys do at NAMI, blah, blah. And I'm like, why? Because I was hospitalized 3 times. I'm like, really? Well, you got to come to our office. You want to be a spokesperson? They're like, no, I don't want to be a spokesperson. See that difference between just like maybe a 40 or 50-year-old versus a 21-year-old who's willing to just sit around the table and say, yeah, I wish this med works, better or whatever. We don't do that, but we would do that with diabetes. We do it with a heart condition or high blood pressure. We have those open kind of conversations. So anything we can do on that end, I think helps even after the fact, but also before.
Yeah. And again, I think the reason and the importance of, this podcast, just starting the conversation, employers need to be more open to talking about this. They need to start bringing in more training opportunities, think about what your orientation looks like for your new employees, what long-term measures you have in place. And we're just so grateful, again, to have partners like Luke Russell with NAMI Ohio and Molly Mottram with the Ohio Suicide Prevention Foundation. We continue to look to them, to our experts in this field, to make sure we are answering the call to allowing and promoting access to behavioral health for all employees across the state. And so I just want to thank Molly, thank Luke again for taking time to be here today. Again, you heard over and over again, 988. If you're having issues, if you're struggling, if you know someone's struggling, don't hesitate to call. The line is always open and you will receive advice on where to go next. Again, I think if you reach out to NAMI Ohio, if you reach out to OSPF, they too are happy to share the resources that they expressed today would be helpful for you and your workforce. So again, thanks Luke, thanks Molly. And that wraps up another insightful episode of Down to Business. If you enjoyed today's conversation, be sure to subscribe for more captivating conversations with key players and influencers in Ohio's business scene. Don't forget to leave a review and share your thoughts. It helps us bring you the content you want to hear. Until next time, stay informed, stay inspired, and let's keep Ohio's business community thriving. Thanks for being with us on Down to Business.